Hi, everybody. Today we have Mark Burghart, the Director of Data Science at WellSky. WellSky is a leading healthcare technology company, and Mark has been leading the development and initiatives for data science at WellSky. So thank you so much, Mark, for coming on to the Explainable AI and Healthcare podcast. Could we first talk a little bit actually about your transition to data science from occupational therapy and neuroscience?
In today's world, I may not be as unique as I used to be, but a long time ago, I left, a clinical background in clinical education and experiences as an occupational therapist, primarily working on the inpatient side. So I was working in a hospital and also worked in an inpatient rehab facility, caring for people after strokes and brain injuries and things like that, and just trying to get them back to an independent state so they could be out of a hospital and doing the things that they love to do before their injuries. But during that experience, I kind of got like this drive to really be involved in the creation of evidence-based practice or evidence-based medicine and care. And the more and more I kind of went to the academic literature to get some ideas on what I should be doing with my patients to get them better faster, there just wasn't like a ton of evidence. And so really got committed to pursuing research. I enrolled in a PhD program that was framed around neuroscience. As part of that process, that got me exposed to neuroimaging, which is also kind of an underlying requirement of that field. Is you need to be able to program at least a little bit, and that was my first exposure to computer programming. I had never taken a course. I had no idea what a terminal was, and things like that. And really thankful for that experience because it really kind of pushed me, I think, into some areas I was really, really uncomfortable with initially. But ultimately, right around the same time, this really emerging field of data science was beginning to kind of take hold. So this was, 10 or 12 years ago. During, my PhD program, I was learning how to use a computer to analyze large amounts of data. And then ultimately, that's kind of what got me into the field today of just data science. And since then, I've worked at some pretty large healthcare technology companies. I think the one thing that separates me maybe from some other, colleagues and things like that is the fact that I do have a clinical background. Like I have cared for people. I've focused on getting people better. And ultimately, as a data scientist in the healthcare field, I think having that appreciation and understanding of what a clinician is trying to accomplish and the decisions that they make on a daily basis really has kind of framed what I focused on and what we develop at WellSky.
Let's get a little bit into the nitty-gritty of like how do you
Yeah,
actually affect the clinical workflows? What sort of data are you bringing to these clinicians?
yeah. So in our world, we at WellSky have tended to focus on those providers who are typically outside of the four walls of a hospital. And a lot of those care settings that you mentioned earlier are like home health, hospice. There's another emerging area that's referred to as personal care, and those are like aids in the home, home infusion, where you're receiving infusion-based medications and things like that in your home. But a lot of the things that we look at in these settings, because they are emerging, are less standardized than what you might find on the inpatient side, for example. But the benefit there is there's just a lot of opportunity for us to really assess outcomes, to deliver helpful recommendations or insights to providers who are delivering care in these settings too. So from a data side, we have the ability, thankfully, to evaluate medical records. Some of them are created and hosted by WellSky. Others are outside of even our company that we're beginning to start to integrate data from, like remote patient monitoring devices like your Apple Watch or home-based scales, which is a really interesting area that's beginning to emerge, where we are more or less being able to define the state of a person without a provider even being in front of them. And so, even other applications that look at like patient engagement, being able to send prompts to a person who is in their home, maybe they're recovering after a knee surgery, asking them how they're doing, how they're taking their medications and how they're responding to it. There's a lot of benefits from an efficiency standpoint where you're able to obtain information about that person without a provider ever taking the time to drive to their home, to spend time with them, and ultimately continue to see progress. So Those are some of the areas that we're prioritizing right now. I will say the things that my team has really focused on from a development standpoint has been around improving decision making for providers. So if you're making, I think one of the most impactful decisions is when a person is leaving the hospital, and that's a collective care team decision on what happens next. Do I send them home? Do I send them home with support? Do I need to pair them with a resource in their community? And then two, like, how do you know that the decision you make is what was necessary and needed for that person? So having a feedback mechanism or a feedback loop for the person making a decision is kind of some of the things that we at WellSky have focused on. But then two, within a single care setting like home health, for example, we do try to predict and provide insights on major risk events. So hospitalizations, rehospitalizations, or readmissions is, I think, a very common proxy for a lot of predictive modeling companies and teams. We definitely prioritize work there. We also make sure that we are delivering insights to make sure that the care setting that is serving that person is most appropriate for them as well. So if you have a home health patient, maybe they've deteriorated to the point they need, to consider alternative sources of care like hospice, for example. And then lastly, we do provide insights into utilization. What is an appropriate care plan for a person? How frequently should they be seen to produce the best possible outcomes efficiently? And that is like a really hard balance to strike, where you see someone enough to produce positive outcomes, improvements in their state, but also not overutilized care where now the cost of that care has become so inefficient that home health agencies themselves cannot continue to operate. So it's like a fine line to walk, where you're doing enough to get someone better, but you're also being equitable in the sense that these agencies need to remain solvent and profitable.
Let's talk about ROI for a home health client where you might not have the same amount of data, but you have the lessons and the infrastructure from other clients.
I think traditionally a lot of analytics teams that build predictive solutions kind of goes, client by client or agency by agency or hospital by hospital. Due to the nature of the settings we support, a lot of our clients and a lot of different entities in these spaces just aren't large. Like they don't have enough data, they don't have enough volume to build a model for them. How do you build something that can generalize to thousands of home health agencies, for example? One that works well with their distinct patient population. People in the South United States, for example, may present entirely differently than people in the Northeast or people in the West. And so how do you build a framework that allows scalability to thousands of agencies that works well for every single one of them? But then two, I think from an ROI perspective specifically, I think that's where we begin to really start to really dig deep on the technology side. Because again, if that can't scale, if a single model isn't, is necessary, but it doesn't work effectively for all of your client base, then they're not going to see return on their investment too. So some of this is really pertinent to machine learning operations. So we monitor, the models that we build, at an individual agency level to make sure that they're seeing, accurate predictions, that they're seeing that one, that they're using our applications, in the first place, but then two, that they're beginning to see, a good return on preventing hospitalizations or being able to identify when a patient is at high risk for going to the hospital in the next week, that they are intervening to prevent it from occurring in some circumstances. So thankfully for us, I think because we have focused a lot about, care setting suitability, preventing expensive medical events like hospitalizations, and as well as, making sure that we're really being thoughtful about utilization. A lot of these care settings are beginning to see a hard push towards value. So you're not necessarily getting reimbursed for the number of visits you complete. You are getting reimbursed on the quality of care you deliver. And so because we have prioritized all those things in tandem, that makes our ROI conversation really, really easy, because we are aiding in that process. People should see, less visits needed to discharge a patient successfully from home health. And they are also having a lower readmission rate back to the hospital, which again impacts their ROI.
Let's talk a little bit about how you think about explainability, trust, and advocacy for these types of organizations and your clients.
We need to be able to kind of meet clinicians where they're at. We need to kind of identify those points where giving them feedback on, in the sense that, hey, you might be missing some key elements about a patient in terms of what they have going on, because you can't scan, thousands and thousands of data elements that are tied to a patient. And so I think a lot of what we're focused on is just trust. I think explainability in terms of the solutions that we build is really paramount to that. And I think we break it down just kind of in two ways. So the first, and I think most important component, is accuracy. So when we are delivering a prediction, it needs to really represent what the person is experiencing. So if someone is at high risk for going to the hospital in the next week, and that does not work well, a clinician eventually is going to realize that that's wrong, right? And so you're now bringing in distrust in a solution, and it's really hard to get that back. And so I think we prioritize accuracy as much as possible. We learn a lot about the decision itself and what we're trying to impact when we think about, machine learning characteristics around recall and precision. Over alerting or alert fatigue in healthcare is now becoming a really important concept clinically. So we know for sure we need to be really thoughtful about, if we are delivering an alert to a provider, that alert needs to be accurate, or else it's just going to be ignored in the long run. But two, in the sense of explainability and transparency, I think it's really important for us to deliver, factors and more or less supporting evidence for why we think what the model is saying. And explainable AI is like this big emerging subcomponent of data science and machine learning, I feel like, over the last several years. And I think healthcare in particular is the one that's driving a lot of that. And that's something I think our team has really evolved our approach to over the last 5 years, where initially, honestly, like our first products, we just delivered predictions. We said that patient is at high risk. And I think really, really early on in one of our first betas, with a client, they gave us feedback immediately and said, well, why? Like, why? And we're like, that's a good reason. I don't know. We need to go look at the data and really think about it. But the more and more feedback we got on that very simple question of why are you telling me your opinion on this patient? A lot of it made us kind of go back to the table and think about, again, like, what is our goal? Our goal is to influence a decision that a provider is making. And if we aren't providing them rationale for why we think a patient may be at high risk when they don't see that, we need to show them, the elements that are contributing to that risk. And so that's really kind of been our approach, is really thinking about, can we deliver, even in a simple logistic regression model, your weights, your coefficient weights. What's the most important thing? What's the least important thing? We've really translated, something as simple as that to something that is more personalized to each individual patient. But then two, I think the last component we think about is actions that they can take, versus just general, elements of a person that maybe aren't impactful but need to be there. An example is age, in healthcare. The older you are, the more likely, just generally, the more likely you are for some adverse events as people get older. And unfortunately, right now in healthcare, you can't really impact age. You can't change someone's age. It is what it is. It's not actionable. But at the same time, we still want to display information like that, because that might be one of those elements that helps build trust with our users. They see the most important thing for this, hospitalization model is the fact that my patient is 98 years old. And, maybe the second most important thing is they have trouble, ambulating in their home, walking in their home. And so seeing those two things in tandem, it's like, well, one is actionable, working on ambulation, making sure they're not a fall risk. I know what I need to do clinically. It's getting a physical therapist in the home and working with them. But then two, it's just having that other framework around, okay, this feature is important. I can't really impact it, but I do need to remember kind of like, this is something that's going on with the person. So
there's a lot of emphasis recently in social determinants of health. And I think that I bring it up because I think that it's a good example of features that are things that a physician wouldn't normally track, but could have high trust and high explainability. Could you talk a little bit perhaps about social determinants of health and that sort of space?
Yeah, and I will say, and again, most of the care settings we support, SDOH stuff is one, it's totally addressable. People are living typically in their communities. They may be homebound. They may just live in their home and have to handle, transportation and services and things like that. But they're not in a hospital. And so, when we have providers going to a home, those are elements that they need to be really accountable for. They need to be inquiring about, because ultimately they also, I think, have a better ability to address those components and get people in touch with needs that are currently not being addressed. And ultimately, when we think about the benefits of machine learning and data science and just predictive modeling, we're trying to aid, a provider, in terms of efficiency, the amount that they have to analyze, really, right? And we can use a computer model to scan, millions of different things about a person. But if we're only looking at clinical features, we're still missing a major component of who people are, right? If you have someone who can't afford to they can't afford to pay their medications, they don't have transportation to pick them up. Like, that's a simple solution in some cases. Maybe for some medications, it's extremely expensive, so maybe it's not as simple. But again, if we're making the assumption that, people should be getting better and they're following a medication plan and they're not, again, like that's another lever that we can pull, I think, from an outcomes perspective to help address, again, getting someone better in a way that does slightly differ from what is clinically traditionally assessed. And so, yeah, totally agree.
I'm really interested in how WellSky, having a large number of clients that might have less patients, how did you scale and perform the machine learning operations to ensure you're delivering good quality to those clients?
We probably follow something that's more framed around, transfer learning. It's not probably written to a T of transfer learning, but we do have the ability of aggregating, and pooling client data together after it's been de-identified, where again, we can learn patterns and clinical characteristics and, eventually, a much deeper perspective on the social and behavioral elements of a person to predict, find patterns and predict, those outcomes. But again, as I kind of mentioned, we need to verify and make sure that that one single model works well with all of our clients, or all of the users of this technology. We can't just build one model and have it work well with, agencies that have, thousands of people and, leave the smaller ones behind. And so what we have a tendency of doing is really focusing on calibration. In some instances, we may have enough data to refit a model, or build a custom model for an individual entity. But a lot of it is actually occurring after the modeling side. So we will evaluate, the outputs of a generalizable model that we build across all of our clients, and then go client by client, evaluate the performance there, and then calibrate, the model and the outputs that produces better performance at the individual agency level. So it's a little bit different than, I think, transfer learning, where you're building you're taking a base model and then continuing to tune it and tweak it and add new features and alter the outcomes. We I think eventually we'll get to that point where we have the scalability and machine learning operations to support something like that. But right now we're still kind of working towards that. But on the true ML upside, like as some of the things I mentioned, like, monitoring of your performance becomes increasingly important. Monitoring the data quality from, thousands of different agencies who have different documentation practices, different workflows and things like that becomes is not increasingly important. It's paramount. So we have all of that monitoring in place today. And I will say too, we have, for us, we have performance criteria where, if we see, given the fact that maybe some data elements have changed, or COVID's a great example. A new condition pops up that is altering the way that healthcare is practiced, or referral patterns are changed, because of COVID. We will have the ability of refitting all of these models, all of these calibrations and things like that too. So it's tough to scale. It's a challenge that we have kind of worked towards over the last 5 years, since our team has kind of been around internally at WellSky. And we have, I think, significantly more work to do to get to where we really want to be, which is probably more along the lines of the true transfer learning, evaluating, conditional aspects of the client size and accuracy at the individual level, because I think I'd agree that the best approach is a model for a single, client or a single hospital or a single home health agency. It's just we have real challenges that we have to work within on the data side of things, and so we will continue to tweak that over time. But the machine learning operations is really kind of what allows us to kind of do what we do today, as well as kind of take steps towards where we want to be in the future, because we've prioritized all that already.
Well, Mark, I've had an amazing time. I've learned a lot about data science, ML ops, and explainable AI, of course, in healthcare from you. If you had one billboard on the side of the road and it had a message you could leave for the general public about healthcare data science, explainable AI, this sort of work, what would that one message be?
So I'd probably go really, this is really generic and it's probably cliche, but I do think it means something, and it does have a tendency, I think, to relate to healthcare, and that is quality over quantity. So prioritizing the quality of care that you're delivering over the quantity of care that you're delivering, and specifically as it pertains to value-based care, and changing reimbursement models, which are beginning to really prioritize, again, delivering great care to the people you have the opportunity to serve, as opposed to just increasing patient volume, I think really matters. Ultimately, I think that's really what we're focused, directly on at WellSky. That's really my personal, a driver, is just improving, care. I mean, a lot of, actually, my personal drive is to try to help clinicians. As a former one, I know how hard that can be. And I think a lot of like the healthcare system in the United States right now is in this really transformational time where we're beginning to realize that quality matters, right? People need care, but if we prioritize quality up front, that need for quantity over the long run actually decreases. And so that'd be on my billboard. I think I'd probably have a bunch of people randomly driving by and wondering what it means, but just prioritizing quality over quantity, and I think great things can happen.